We're pleased to welcome Dr. John H. Hajjar, who is Chairman and CEO of Sovereign Health System. Good to see you.
Thank you. It's a pleasure.
And it's good to have you. Now, this Sovereign Health System, fascinating. Started in 1992?
Yes.
What's the whole idea behind it?
Well, it started as a surgery center, and I finished training at NYU. At that time, I was doing a lot of laser surgery on an ambulatory basis. So when I first started practice, I wanted to do something that was unique, that could differentiate myself from the community. So this company called Laserscope, they said that, why don't you write a paper for us, and we'll bring in the laser machine and put it in your office, and you go ahead, treat the patients. So they brought it in, and I started treating patients, and it worked very nicely. Laser prostate surgery on an ambulatory basis. So wrote the paper. It took me about a year. After we treated about 110 patients. And once I wrote the paper, they wanted to take the machine away from me. I said, you can't do that. You know, patients love it, and the outcome was terrific. So why don't I buy it? They said, well, it's $200,000 for a laser machine. I said, I don't have that sort of money.
You didn't have it in your pocket?
Nothing at all. So they said, well, you could open up a surgery center. So that's how they gave me the idea of opening up a surgery center. I didn't know what a surgery center was all about. So I went ahead, and through their help, they connect me to the Department of Health in the state of New Jersey.
Sure.
And we opened up one of the first surgery centers in Bergen County. Now, it required significant capitalization. I didn't have any money to open up a surgery center.
You had to get other people.
I had to get.
How hard was that?
Very, very difficult. No one wanted to join.
No one. No one. Let's do this.
Yeah.
We'll do the long version another time, but why was it so tough to get people to invest?
Because it was, most people, most physicians, almost all of them are risk averse. And it was something that was totally unique, and they said that it was going to fail. Why should they spend the money to open up a surgery center that's going to be closing down in a few years, they thought.
Right.
And at the same time, it wasn't a concept that was well looked at.
They're like, go ahead and prove it, and then we'll see.
That's correct.
But you can't do it that way.
No.
You need other people.
Correct. You need other surgeons to participate to bring in the surgery.
And that's 92.
That was
fast forward. Let's talk today. What do you have today?
We have 13 surgery centers on the East Coast. We have surgery centers in Florida. We have most of my centers are in New Jersey. We're building. We have one on the east side of Manhattan. We're building 3 more in Manhattan itself, and we're expanding. We're expanding our footprint. We want to go into Connecticut. Now, because of that experience that I've gathered from the surgery centers, I've veered into other business lines.
And so a multi-specialty group?
That's right.
Talk about that. What does that mean?
It's a multi-specialty group, which is composed of general surgeons. It's composed of gynecologists, urologists, plastic surgeons, ENT, ophthalmologists, and primary care physicians. And all these physicians got together under one tax ID number, and they in turn will feed in to the surgery centers. They will send their patients to these specialized surgery centers. So we have some of our surgery centers are centers of excellence in treating specific type of diseases. So we have a center that does just orthopedic surgery, where hip and knee replacements are done on an ambulatory basis. You want to have your hip replaced, you could come to our surgery center, go home in 4 hours. Very specialized technical skills is required by the surgeon.
You know, I'm fascinated by this because you're talking about a lot of clinical challenges and a lot of clinical things you're doing, but what's really interesting is the folks at Ernst & Young 2014 Entrepreneur of the Year Award.
Yes.
You become an entrepreneur that a lot of people recognize in the industry. Did you ever think to yourself, when you were 15 years of age, you came here with your parents from?
Aleppo, Syria.
From Syria. Yeah. Did you ever think to yourself, I'm going to be a great business person one day? I'm going to be a great entrepreneur one day?
Absolutely not.
That wasn't the plan?
It wasn't the plan.
Was it just required to do what you're doing?
Well, yes, I had to do what I was, in order to survive in the beginning. Because Survive, actually.
Why, devil's advocate.
Right.
Someone says, I'm just going to be a great surgeon. I'm just going to be a great clinician. It'll all work out. Doesn't work that way?
Right. No, it doesn't work that way anymore. So in this environment right now, if you want to be a great clinician on your own, you're not going to be able to make it, simply because it requires a lot of overhead. You have to be part of a larger organization in order to support you. And if you are going to pay a lot of a lot of attention to the business side of medicine, you're not going to be able to practice medicine the way you want to.
Balancing act?
It will be a terrible balancing act right now. In order for you to become a good physician at what you do, you got to let the business aspect of medicine to go and give it to somebody else.
Well, hold on, but you are an entrepreneur.
Yes.
And you do understand the business.
Correct. It's unique.
But here's the thing, I want to understand this. But you're still involved in the medical side.
I'm no longer practicing. I stopped practicing about a year.
But you're recruiting physicians.
Yes.
But I see it's a game of semantics.
Right.
You have your hand on the quality side.
That's correct.
You care who you bring in.
Absolutely.
You're just not hands-on on the clinical.
On the clinical aspect. See, I've been on the clinical side, hands-on on the clinical side. I know all the upsides and the downsides. I want to make sure that the doctors come on board, do quality medicine in a cost-effective way. I want to pay them well. They deserve the best that they can get as far as dollars are concerned. But I want the best outcome that's possible.
I've asked a few of your colleagues this question, but particularly someone who's built what you've built.
Right.
It's important I ask this.
Right.
What would you say the #1 lesson you learned about leadership so far is?
Transparency. You have to be transparent to the doctors. And transparency in the sense where what is the right thing that they're doing and what is the wrong thing that they're doing.
And when you acknowledge that something is wrong, you confront it directly?
Absolutely. Confronting it as soon as possible rather than wait for it. And once you wait for it, it just gets worse.
Always tell people that hope is not a plan. You agree?
That's okay. Yes, that's true. Hope is not a plan.
Doctor, we thank you for joining us. Dr. John H. Hajjar, who is the chairman and CEO of Sovereign Health System. I want to thank you for joining us, and we appreciate you shedding light on this very important topic, and I wish you all the best.
It's a pleasure to be here. Thank you very much.
Stay right there. Stay with us. We'll be right back, right after this.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by Investors Bank, United Airlines, St. Joseph's Healthcare System, MagnaCare, Verizon Communications, Johnson & Johnson, and by New Jersey Sharing Network. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.